Over the past couple of months talking about microclots and platelet hyperactivation in long COVID, multiple people have asked the question, can aspirin be used to treat long COVID? Today I want to examine the known information about aspirin and the data about how it can be useful in treating long COVID. Aspirin has two main therapeutic uses, each with a different dose. The traditional use of full-strength aspirin, that's the 350 milligram tablets, has been as an anti-inflammatory to treat pain and fevers. Low-dose aspirin, the 81 milligram tablets, are taken to prevent heart attacks and strokes. Daily consumption of low-dose aspirin is thought to thin the blood, reduce blood clotting, reduce inflammation in the veins and arteries, and help maintain healthy blood flow. This leads many people to wonder that since aspirin acts as a blood thinner and helps prevent clots, shouldn't it help with the microclots found in long COVID? As with most things, the answer is both yes and no. Aspirin, including low-dose aspirin, can inhibit platelet activation and aggregation, which should help reduce blood clots. And in a long COVID study, aspirin prevented platelet hyperactivation, but it did not prevent microclots. In that study, data was presented from patients that had been self-administering aspirin as a treatment. In long COVID patients that had not been taking aspirin, typical microclots and platelet hyperactivation are observed. In long COVID patients that had been taking aspirin, only microclots are observed. When the patients are taking aspirin, the platelets look normal and are not hyperactivated, as usually seen in long COVID patients. So what conclusions can we draw about the use of aspirin to treat long COVID? Aspirin alone can reduce platelet hyperactivation observed in long COVID patients. However, aspirin alone cannot alleviate the symptoms of long COVID despite reducing platelet hyperactivation. In patients that are self-administering aspirin, the long COVID symptoms likely persist due to the untreated microclots, which are clearly still present in these patients. The use of aspirin seems to parallel the use of anticoagulants to treat long COVID. Remember that anticoagulants alone cannot alleviate the symptoms of long COVID, likely due to untreated platelet hyperactivation. If you want to see a written summary of this info and these images, check out my bio and click the link. And as always, you can follow my research and give me feedback by leaving me a comment, checking out my bio, and following me. Thanks, and see you next time.